Yeah, well said. I know I've heard you both speak before, just in general with studies. Jen, particularly, you've said it's never too late to help jump in and fix. And so for those who are hearing this for the first time and thinking about, oh no, they have studies underway, or studies that have just closed out, what would, it sounds like that they just need to outreach in general. And it's there's always a voice that can be raised, a concern that can be raised, new data that can be input. So for those who have studies going underway right now, what would you recommend? Just one step, one thing, just get out there and get in there and get talking, or what's the best path to start down that fix?
It's important to always be willing to make changes and make edits. I think that starting conversationally and working with patient advocacy organizations, working with patients who are already identified by these companies, and bringing in the caregiver voice when you bring in the patient voice, and really asking for feedback. I think that there are ways to do that in sort of a compliant way, of course. And I think that there are also ways to add them to clinical trials, either retrospectively or, going forward. You can actually get validated instruments that do a much better job asking patients and caregivers to report back on what's going on. But you can't know until you ask. And so I think the reason that things are getting better, from my perspective, some of these studies designs are getting a little bit better and a little bit less burdensome, because they realized that, in my mind, flying back and forth for blood work when we didn't even need a dose, was really ridiculous, because local labs can do blood work and we can have it done in our home. And I'm seeing families getting home infusions. I had to wait almost 3 years for a home infusion. And so those are the kinds of things, incorporating flexibility and understanding patients' burden and caregiver burden and the needs that they have. You can make small changes. If it makes a difference to give a family a gas card, so to get them to the hospital, you won't know that until you talk to somebody. Or I was talking with one patient and she was saying, boy, it's really hard because the only place I can park is $60 a day.
Wow.
And I said, aren't they compensating you? And she said they didn't ask. And so it's those kinds of things where she actually was considering dropping out of the study because $60 a week was prohibitive. And if somebody had talked to her, then we wouldn't have had to worry about, her potentially not being compliant and removing her son from the study.
You referenced, Jen, the patient advocacy groups, and really hadn't thought of it till right now, but maybe that's the entree into pharma, because the groups, the organizations, depending upon the therapeutic area, seem to have fairly strong relationships with a lot of the companies who are developing therapeutics in those particular areas. And so maybe creating an awareness through these advocacy groups and letting them know about some of these issues, because as far as my experience, and I've worked with a number of groups over the years, they do great work on behalf of the patients, but there really isn't an awareness, at least I can't perceive it, or any indigenous programs in these groups that are directed solely at the care partner. And I think maybe that's the way to establish this. So when patient groups are engaged with a trial site and they're looking for patients to recruit, maybe there's a discussion about, okay, once you recruit the patient, what are you doing to support the care partner who's going to, in some shape or fashion, is going to be involved in the same trial. They're not taking the medication, but they're going to be mostly every step of the way. And so
they influence,
that's the way to do it.
They influence compliance as well. I mean, if you don't have well-educated and supportive care partners or caregivers, then you run the risk of having patients that are non-compliant, because if they can't get to the site, or if they're not being reminded to take their pills, or if they're not being provided the support, if they're not going to be kept inactive, if patients aren't kept inactive before their 6-minute walk test by their caregiver, if they don't know to do that, then it can ruin trial results. And so, really educating and supporting the parent or the caregiver is really important.
Yeah. That's great to hear. Just all of the insights today. I really wanted to thank you both for your time. I think that there's so much here that, you know, again, I'll go back to Paul, you know, you hope they thunk it, but I think that there's so much here that just from talking to you too, from deep diving, from listening to your experiences, you know, it's unfortunately, it seems like it's not as thought about as maybe people would like. And you know, there are really good insights to hear. There are really candid insights. I think it's very important, you know, to open these discussions, to have these steps, and because really it's the only way that we fix it. So again, I wanted to thank you both for coming on here today and talking about, you know, your lives so intimately, so detailed, and what it's been like. Thank you so much.
Thanks, Dan.
Thank you.